My name is Dr. Bobafanyo Amadison. I'm an ENT surgeon who is also interested in snoring and sleep apnea. This snoring that we talk about is just a sign that your airway has narrowed. And you know, it's like a wind instrument. The music is made because the instrument has a narrow passage and air is flowing through it. So when you're breathing at night and you're snoring and your airway narrows, it begins to make noise. And that's what we know as snoring. So you can see the airway has narrowed. And this airway narrowing and the noise is not just a social inconvenience annoying your bed partner. What it is a warning sign that you may progress to a condition called obstructive sleep apnea. Obstructive means the airway collapses completely. And sleep means it happens while you're sleeping. And apnea means you stop breathing. Anything from 10 seconds, and some people stop breathing for as long as 50, 60 seconds. And this can happen repeatedly throughout the night. I've seen people with sleep apneas of less than 5 an hour, and I've seen patients with sleep apneas of more than 100 times an hour. So if you have these repeated disruptions in your sleep, one of the first things you're going to notice is you do not sleep well. You wake up feeling unrefreshed. You wake up and you're like, I feel I just slept. A couple of people have bed partners that will even tell them you were snoring during the night and suddenly you stopped breathing. I had to tap you on the back before you started breathing again. It scares people, especially when it happens to children. Parents get very scared. The child stops breathing and then resumes breathing again when they're shaken or touched or whatever. So imagine this happening repeatedly. That means each time it happens, oxygen is cut off to your brain for a few seconds, sometimes more than a few seconds. And then your chest, your body, you have to struggle to breathe again. And that means the brain keeps on waking you up to start breathing again. And this struggling, when the heart is struggling to pump oxygen to the brain, which has been deprived for certain periods of time, other effects start to happen. In some people, because of this repeated struggling to breathe and everything, they end up with hypertension. So you have a youngish male, a youngish female in their 20s, in their 30s, coming down with hypertension. And this hypertension tends to be drug resistant, that you try different drugs and you're just not improving. This is because your sleep is being interrupted and you're struggling to breathe while you're sleeping. Other conditions such as diabetes are also associated with sleep apnea, because when you sleep, you don't just close your eyes and your brain shuts off. A lot of things are happening there, and these include the regulation of your body's insulin levels. It also takes place during sleep. So if your sleep is repeatedly interrupted, you might end up being diabetic or pre-diabetic. You also have the hyperdyslipidemias, which is your blood fat levels, your lipid levels, your cholesterol levels going high, also because your sleep is being affected. And people that are not sleeping well end up with depression, loss of concentration, they sleep off at all sorts of times. A lot of accidents have been caused by this obstructive sleep apnea, leading to daytime sleepiness. So if you think you have sleep apnea or somebody around you has sleep apnea, what's the next step? The next step is, if it's a child, see an ENT surgeon. If it's an adult, that person will definitely need what is called a sleep study. And these are usually done by ENT surgeons or some respiratory physicians. And it's done here in Cedarcrest. A sleep study studies what is going on in your body while you're asleep. It tells us about your breathing, about your heart rate, about your oxygen saturation, about your snoring, which is what alerted you in the first place. And these are rare. In times past, patients all had to go to Lagos to get these done, but they can now be done here in Abuja, in Cedarcrest Hospitals. And then the management will depend on what we find. And there's a long list. It can start from simple measures where we take care of your diet, your sleep pattern and all, or we can have some people in extreme cases needing surgery. But there's a wide range of treatments, And we can do all of them here for you in Cedarcrest Hospitals.